Hey guys, thanks for coming.
Are we in trouble?
No, you're not in trouble. I just want to set some ground rules.
Like what?
Well, remember last week when you hit Vinny in the head with the shovel?
I do not recall that.
Of course not. Well, it was pretty graphic. Too graphic for the kids. So I'm gonna have to block you.
I got to make this up to you. This is Vinny's watch, and I want you to have it. You deserve
No,
it.
thank you. That's really not necessary.
No. Come here.
Welcome to this edition of Life's Perspective. I'm Mike Miller. My special guest today from Fairfield Medical Center, Joyce Cox and Ivy Neal. Welcome.
Thank you. Glad to be here.
Thank you for being here today. Talk a little bit about your positions at Fairfield Medical Center.
Go ahead. Well, as you said, I'm Joyce Cox. I am a nurse practitioner. I'm an oncology nurse navigator. Recently completed my MBA because I'm really hoping we get a cancer center here in Fairfield, at Fairfield Medical Center. And Ivy and I work together. I'll let her tell you about herself. And we assist cancer patients through their journey, trying to make things easier for them, help answer questions, and guide them through this troubling time.
Mm-hmm. Ivy?
I'm Ivy O'Neill. I live here in Lancaster and work at Fairfield Medical Center as the second oncology nurse navigator. I see a lot of patients diagnosed with lung cancer, and we're developing new programs to help that certain population of patients diagnosed with lung cancer.
Well, Joyce, you mentioned we hope to have a cancer center. What does it take to have that? What is it?
A lot of work, a lot of collaboration, a lot of services we offer our community now that the community isn't always aware of.
What are some of the services?
Well, we offer chemotherapy, radiation therapy, surgery, whether it's for a mastectomy for breast cancer or taking out your colon if you have colon cancer.
Or for your lung cancer, removing a nodule or a lobe of the lung.
We do a lot of imaging studies to diagnose cancer. We have pathologists who actually look at the tissue once a biopsy's taken. And we have radiologists that do the CAT scans and PET scans and help us stage cancer.
Is it getting a cancer care center? Is it obviously a question of funding? Is it a government funded? Is it state funded, private funded? How would that happen? You're shaking your head no.
I wish it was government funded.
Yeah.
It's it can be virtual in name only, or it can be bricks and mortar. And as we are offering more services, including navigators, a lot of hospitals didn't have that. That's becoming standard of care. Survivorship programs. So you went through cancer treatment. You go home. Now what? How much surveillance do you need? It's clinical trials. There's so many things involved in a cancer center.
Therapy.
It's a strategic plan.
Therapy services, nutritional services, all of those.
Rehab.
When you were growing up, is this what you thought you'd be doing at this stage of your life?
I always knew I wanted to be a nurse since I was a very little girl. Working with cancer patients only? No, I did not think that.
I didn't know that until a year after I graduated from nursing school. So about a year after that, I knew that's who I wanted to work with. Those are the patients that needed the most help in my eyes. So.
If you're just tuning in, I'm Mike Miller for Life's Perspective. We're talking with Ivy O'Neill and Joyce Cox from Fairfield Medical Center, talking about cancer and some of the issues that go with it. When we talk about cancer, and I know we're going to talk about some programs that you're involved with, talk a little bit about statistics of cancer. I know people are overwhelmed. Just my time that I spent in a hospital, people were talking about statistics, not through cancer, but through another issue I had to deal with. Talk a little bit about statistics.
Well, cancer is very prevalent, and in Ohio alone, there's over 66,000 people a year diagnosed with cancer, just in Ohio. And within that 66,000, over 25,000 of those people diagnosed end up dying from cancer each year. So it's very prevalent. It's a serious disease, and American Cancer Society has done a few cancer prevention studies like the one Joyce is going to tell you about here to help battle the fight for cancer.
What are some of the, I guess, signs of cancer that people can talk about? I mean, is there something that, a spot on your arm, or, talk a little bit about some of the things that people could look for?
Well, I specifically work with the breast and colon cancer population, and I'll let Ivy talk about her population. We share others. Of course, if you have a spot on your arm, number one, we hope that could have been prevented with sunscreen. So there's a lot of prevention things that we as consumers don't do that we could. So I work with breast cancer patients. I teach them how to do breast exams, how to know what your breasts feel like, so that you can get a mammogram and a clinical breast exam with your physician or your nurse practitioner or your physician assistant. So knowing your own body, no matter what type of cancer, is so important. Patients sense when something isn't right. Colon cancer, on the other hand, we want you to get a screening colonoscopy at age 50.
How often should you have one after age 50?
Depending on what they find.
Okay.
If you have a family history, you need a colonoscopy before age 50, if you have a first-degree relative, mom or dad. After you've had your screening at age 50, if you have polyps, you're going to be asked to come back either at 1 year, 3 years, or 5 years, depending on the type of polyps. And then, if you are clean, 10 years. Well, most patients think 10 years, I don't have to come back.
Right.
Well, you still need to listen to your body. Colon cancer is silent. By the time a patient has rectal bleeding, they usually have cancer. And most people attribute it to their hemorrhoids. Colon cancer does not usually hurt.
When you talked about age 50, is it, I know men sometimes think, I don't need to do that. But, could you do it at 30 if you wanted to, or 40, or is it just recommended to do it at 50?
It's recommended at 50 if you want your insurance company to pay for it. We can get it approved sooner, but there has to be a reason to have it sooner. If you're symptomatic, having rectal bleeding, or you have a first-degree relative, there's a strong family history, certainly that can be done sooner.
Wow. Ivy, talk a little bit about yours.
Well, like Joyce was saying, usually signs and symptoms don't show up until a cancer's a later stage, and it's harder to treat at that point. With lung cancer, the population I work with, there are signs and symptoms like coughing, coughing up blood, shortness of breath, those weight loss, those type of things are signs and symptoms of a cancer that's usually a little bit more advanced. So the number one thing patients can do is not smoke. And if they are smoking, try to stop smoking. We have smoking cessation programs at Fairfield Medical Center to help patients through that. They can call the 1-800-QUIT-NOW line to try to get assistance to quit smoking. It takes smokers generally, 9 to 10 times to try and quit smoking before they actually quit. So
it takes 9 to 10 times of treatment, or just the program to start the program?
No, making that decision, I'm going to quit, and trying something.
I never smoked, so I don't know.
Yeah, whether it's medication or patches, that really talking to their doctor when they're ready to make that commitment to quit smoking. That's the best thing to prevent lung cancer in you and your family, the people you smoke around. So,
Are there any statistics, women versus men, that...
Depends on the type of cancer. Of course, prostate cancer is only in men, breast cancer is only in women. Colon cancer doesn't specify, or isn't more prevalent in a male versus a female.
same for lung. There's not, they're showing some incidences of lung cancer are decreasing in men and they're increasing in women, but it's probably related to the smoking rates and things like that. But it doesn't, cancer's not biased. Doesn't care if you're a man or a woman.
The people talk about diet and exercise all the time, and not to look at me, but I do exercise a lot. You know, and at one time my diet was Ho-Hos and Mountain Dew. But talk a little bit about diet and the role it plays in everyday life.
Absolutely, it's proven. Research has shown that there's an increased risk of many cancers in obese patients. So we want you to have a well-rounded diet. We want you to eat healthily, lots of fresh fruits and vegetables, fiber, and I'm thinking from my specific type of, and I'm not a good role model, so I don't want to go into my eating habits, because I saw Ivy smile about that. So yes, diet and exercise, that keeps our weight down.
Right.
So we know that exercise will keep our weight down. We know that increased weight equals increased risk of cancer. So they go hand in hand.
And people talk about, well, I don't have time to exercise, right? You know, I grabbed this for lunch because I couldn't, you know, I had to drive through because I had to be back to work. But did you think in America today, this is 2013, as compared 5 years ago, I mean, how the shape the country's in? I mean, obviously you've talked to a lot of professionals, but does it amaze you that, gee, how can we get this bad this quick? I mean...
It's been a transition, don't you think, Ivy?
Yeah, I think
It's been
so.
a transition. In Ohio, we're not healthy. We
Yeah.
don't eat and exercise. The portions we used to eat were when we were out farming. If you think back at our
Right.
ancestors, they worked on the farm, they worked very hard. Their diet was different, but so was their level of activity. Think how many of us sit in front of a computer every day. We're not really moving.
Right.
So
The one good thing, though, I think a lot of employers, and Fairfield Medical Center is doing this, and many other employers around Ohio are getting their employees active. They're offering
Right.
incentive programs. That's the big push now. So I think that employers in Ohio they get it, and they know that we need to decrease our risks by getting active, eating right. Cafeterias are offering more diverse food choices
Right.
and the activity program. So I see the move going in that direction. We just all need to get
and
on
we
the
have the
bandwagon.
Fit Together program.
Correct, that's right.
And honestly, with our health premiums, we're held accountable. So if you don't try to adapt a healthy lifestyle, your premiums are going to be higher. We're insurance poor in this country because we don't take care of ourselves.
Oh, I agree. What do you guys do for exercise? You like to run? What do you guys do?
I've recently started running. I don't really like it. I'm forcing
But I'm going to do
myself.
it anyway.
But I love to walk. I love the elliptical. I do things like kickboxing and TRX, different little.
Really?
I have to have a combination of classes, or I get bored very easily. So, and I have kids that we go and do fun things with. But
Well, that's great. Trish, what do you do for exercise?
I primarily run. I found that that's the easiest and quickest way to keep weight off. And, yes, well, the other part of that is you go for a morning run, check. You've done your exercise for the
Okay.
day. And I do like to bike. I haven't been faithful at that this summer. And I like some water aerobics at times, things like that. But primarily, what's worked for me is running.
It's fantastic. I can't run anymore. I had one knee replaced and my other one shot, so I don't run as much as I possibly can. But it's fun. Well, I know we're talking about health and diet, but we want to talk about the cancer prevention study that you both are involved with. Let's talk a little bit. It's the American Cancer Society Cancer Prevention Study 3. Let's talk a little bit about that.
We're really excited to be part of this. It's actually the Cancer Society's 4th prevention study, but it's called the CPS3, Cancer Prevention Study 3. Fairfield Medical Center is involved, and we're partnering with the Cancer Society to find out how we can prevent and save lives. It's a nationwide study. It's going to examine genetics, lifestyle, and our environment of cancer and how we can better prevent the disease. It's not going to help Ivy and I or you in our lifetimes, but it's going to help future generations.
Now, to participate in this, what do people do, or what do they have to do? Is a certain marketing group we're looking at, or talk a little bit about
Yes,
that?
you know, for it to be a study, they do have to narrow down who is participating so that they can obtain accurate results. So in order to participate in the study, you must be age 30 to 65 years old. You have to have no history of cancer. Now that's your personal history of cancer. Family history does not matter. But you yourself cannot have had cancer, and you must be age 30 to 65. Now some people, you can in this study have basal or squamous cell cancer of the skin.
Okay, explain what basal and squamous, I don't know.
Oh, it's a skin cancer,
Okay.
and there's melanoma, there's basal, and there's squamous cell, or squamous cell. Melanoma of the skin would exclude you from the study. But if your doctor has told you, and most people diagnosed with it will know, I had basal cell, you know, those little spots that elderly people get on their foreheads and face, you know, those type of things. Well, in trying to describe it so people out there understand, they're very easily removed, and you move on. You don't usually have to have other treatment. So if you've had those two types of skin cancer, you can participate in the study, but no other type of cancer.
So how do people get signed up? Do they come to the hospital? They go online? What's the easiest way to sign up?
We've been trying to get the word out. The best way to sign up is to go to the website. It's www.fairfieldcps3.org. You'll fill out a brief survey, and you'll schedule an enrollment appointment, which we can tell you about. The initial health survey does take about 45 minutes, but that's a one-time survey that you have to take that's that big of a time commitment. And you do have to show up for a one-time blood draw and a waist circumference.
Oh, my.
Just one, just
my.
one.
Altogether, though, to participate in the study initially, it's going to take probably less than 2 hours,
Oh, okay.
an hour and a half of your time to get enrolled in the study.
Now, how long will the study be? For a year, 6 months?
Almost 30 years.
Oh, almost
20
30
to
years.
30 years. But you're not committed. We are looking for long-term commitment. But you'll just have to fill out a survey online every 2 to 3 years.
Yes. They'll mail you a survey. After your initial enrollment, they will mail a survey every 2 to 3 years. You'll fill that out, send it back in, and you're done.
Okay. Okay, that's why you said, okay. I understand that. Now, you have some partners in the community that are helping you out, the YMCA and some other people?
Fairfield Medical Center is one of the enrollment sites, and Pickerington Public Library and Ohio University Pickerington Center and the Robert K. Fox Family Y here in Lancaster. They're all recruiting and participating in the study. Once you go to the fairfieldcps3.org website and complete your health history and summary, you'll be asked to choose an enrollment date, and the enrollment date will be for one of those sites, either Fairfield Medical Center, the Pickerington Library, Ohio University Pickerington Center, or the Robert K. Fox Y. So you can choose one of those dates and times, and then that's when you'll go in for your in-person interview. Your waist circumference, your blood draw. It's a little blood draw, just a small, minimal blood draw.
I'm worried more about the waist circumference.
Okay.
So
Blood
am I.
draw, I'm okay
We'll
with.
pull yours really
Yeah,
tight.
Thank you very much.
I wanted to pull mine tight too, so it's okay.
I know that, so this is starting now, or it has been going on, the study itself, is it kicked off?
Enrollment is going on now.
Okay.
And yes, it's just now coming to our area, but it's a nationwide study, and they want 300,000 people. And
Across the United States?
Yes,
Okay.
and we have 267,000 as of
Something like that.
as
yeah.
of June.
Wow.
So we're very close to meeting goal. Ohio is ramping up, especially we are ramping up
Right.
and really talking it up, trying to get people to be interested and participate.
Do you think people are more aware of cancer today than they were 10 years ago?
I think they are, yes. There's a lot of lots of new cancer centers going up. You see the commercials for big cancer centers out west, and I think that people are getting diagnosed earlier because of our screening methods, and it's becoming more prevalent in families. Most people have somebody in their family that's been diagnosed with cancer, so.
Or a friend. Everybody knows somebody that's been
Right.
affected.
Do you know anybody yourselves that have had cancer?
Yes.
My mother passed away
Oh.
from cancer, so I've dealt with it
Very close.
firsthand. Oh, yes, yes. It's painful, and I think that helps me be a better navigator. I understand patients and how I felt. I don't know if they feel that way,
Right.
but I'm able to talk to them better.
Is it people better understanding cancer, or is it more of a situation where people today that, oh, I understand it, but my family doesn't? Does that make sense? Does the patient understand it easier, or does the family understand it easier? Is that?
But we help do both of those.
Right.
okay.
I think it's different for every person and their background, their education level, their exposure to cancer. A lot of patients have no education, and they've been to the doctor with their mother who had colon cancer, and they have a very good understanding of it. So that's part of our role, to assess the patient's needs, to assess their family's needs, and provide the education and information that they need.
Contacts for both of you, or is it phone, email, whatever? What's the easiest way to get a hold of you?
Either way is fine with me. My email address is joycec@fmchealth.org, and my phone number is 740-687-8863.
And my email is IVO, that's IVYO, at fmchealth.org. And my phone number is 740-689-6889.
Has there, not specifics, has there ever been a time when you've gotten to a point of, I need to take a break from this?
Absolutely. We are so fortunate to be let in to patients' lives at a very vulnerable time. We're blessed. We have wonderful patients. Sometimes you get so emotionally involved with yourself. I should speak for myself. I shouldn't speak for Ivy. I get so emotionally involved that at the end of the day, sometimes I just collapse in tears. And that's when I realize there's a reason that the hospital says you need to take X amount of vacation a year. That's why they grant it. You need to step back at times. And I'm getting a little better at it. Certainly haven't mastered it.
Yeah, it's the same. I mean, you get involved emotionally with your patients because they're going through a traumatic part of their lives, and you can't help but want to make their journey easier and just reach out and really be there. I tend to want to be there every step of the way, and you do have to at some point say, they have their family to lean on, they have chemo nurses, radiation staff, there are other people that are there. Everybody at the hospital takes great care of our patients, so it's hard to not get emotionally involved and be sad when you lose a patient, and it reminds you of what you went through with your loved ones, and but it's part of our job. I think any field of nursing, any area of nursing you're in, you experience that. The loss of patients and the emotional issues they go through.
And I know the hospital provides a lot of tests, a lot of free tests. I know being involved with the Susan Komen Foundation. Talk a little bit about that and some of what it means to Fairfield Medical Center.
This is the third year we've been a partner with the Susan G. Komen Foundation. We've been so fortunate to be awarded a grant. Our first year we were able to provide 100 free mammograms for uninsured women. Last year we were able to service 125, and this year 125. So that really has helped women who don't have any insurance, that have no way of getting a mammogram. We call it no excuses. When we wrote for the grant, that's what we called it, no excuses, because we would get excuses from women. And now there is no excuse. We are here to help. We have a Komen grant administrator on board to assist us because it's gotten so busy. So if someone needs a free mammogram, they can call Carol DeSanto at 740-243-8924. And Carol leads you every step of the way in what we need and how to get you scheduled, and make sure that next year you get a repeat mammogram, because it is recommended to get a mammogram starting at the age of 40, unless there's breast cancer in the family, and then annually. So it's not just a one time.
Is that a thing, as we talked about men and prostate, I'm not getting checked. Do women have the same thing about mammograms?
They do. They do. Well, if you think about it, your breast is being compressed. Women have visions and kind of horror stories in their minds. Our mammography staff are wonderful. It's not the most comfortable thing I've ever done in my life. However, the benefit outweighs the moment of squishing.
The medical term is squishing.
Squishing, yes.
I know that we've just got a few minutes left here, but advice to people that look at cancer and put their head in the sand and say it's not going to happen.
Well, my advice would be never say it's not going to happen, because like we talked before, cancer doesn't discriminate, and you may be living that healthy lifestyle, exercising, eating right, but statistics are proof that it can happen to anybody. Cancer risks increase with age, and so getting those screenings, colonoscopies at age 50, mammograms at age 40, quitting smoking, going for your annual primary care visits, those are what's important to prevent and detect cancer at an early stage.
Eat right, exercise.
No more ho-hos and Mountain Dew, is that what you're saying? It's okay.
I say everything in moderation. I don't tell people you cannot have this, because that's the first thing they want, including me. If someone tells me I can't have something, all of a sudden I want it.
I understand completely. Is there a website people can go to, or brochures at the hospital about statistics that they could do research if they were looking to just find some more information?
We usually advise patients not to go on the website without talking to us, because we have a lot of reputable websites.
Okay.
But anybody can start a website. So what happens sometimes is these blogs really frighten patients. They go on the website and they're calling us, and they're very upset and scared and have already awfulized the entire disease, when in fact their pathology report's different than what this person on the blog. So no two cases are identical.
Right.
So everybody's an individual, and we will guide them if they call us. Depending on their situation, we will guide them to a reputable site. We have our favorites that do a very nice job with research and statistics.
Fantastic. Well, Ivy, Joyce, it has been great having you both here today to talk about cancer. Good luck with the study that is going to be 30 years. Is that what it's going to be about? So
the enrollment finishes up this December 2013.
Okay.
So we're looking to get at least 500 people in Fairfield County and the surrounding counties. So.
And again, just call you at the hospital is the easiest thing to do.
Absolutely.
Give me your phone numbers again one more time, and we'll get them up on the screen. But.
Mine is Ivy O'Neill. It's 740-689-6889.
And mine is Joyce Cox, 687-8863. And I'd love to sign you up.
Absolutely.
I'm going to get him.
Yeah.
Well, sure.
Yeah,
We're working together.
Absolutely. Well, again, we hope that the Care Center for Cancer becomes a reality at Fairfield Medical Center. I know a lot of people that have been touched by this disease. So we do appreciate you coming in. What's on the agenda for this afternoon? We going running, going kickboxing? What are we
Lunch.
doing? Lunch. There we go.
We're going to lunch, and today's my wedding anniversary.
Fantastic.
Going
How long?
to dinner. 20 years.
Congratulations.
Thank you.
Fantastic. Any place special that
Well, actually,
You don't want us to show up at?
Actually, we have family coming in, so we're going to Shaw's.
Oh,
So we're
fantastic.
staying local and supporting local.
Fantastic. Well, again, we do appreciate you guys coming in, and have a great day, and appreciate all the work that you're doing for all the cancer research. And
Thank you.
thank you very much for being here.
Thank you for having us.
Thank you.
Thanks for tuning in to this edition of Lank's Perspective. I'm Mike Miller. Remember, until we meet again, let's make a difference.
We are different. Society should aspire to be more like us.
Be part of the first class. Get energized. Get outside
Hold on, guys. It's gonna get bumpy.
and get moving. Experience the power of physical activity. Join the movement at ActionHeroAlliance.com.